Hello everybody, my name is Eva Tracullia. I'm a school nurse and I work for Northamptonshire Healthcare Foundation Trust. I would like to offer you all a very warm welcome to this video, which is part of the SAPHNA Annual Conference 2021. This is an opportunity for us to celebrate some of the wonderful, innovative practice in school nursing as a response to the COVID-19 pandemic. Despite the pressures, trials and uncertainty that the pandemic brought, school nurses have continued to demonstrate that they can adapt and rise to the challenge. The children, young people and families, as always, have remained at the centre of all we do, and that is what has driven us to meet their needs and provide that early preventative care. SAPHNA were quick to recognise that the school nursing workforce needed that extra support, and many of us were able to access webinars, enabling contact with other school nurses across the country. This platform enabled the sharing of ideas, innovations and outcomes. If you haven't already, then I recommend that you look at the SAPHNA website and have a browse. There you will find a selection of COVID-19 case studies to inspire you and details of upcoming webinars and much more. Now we have to acknowledge that at times we will feel daunted, overwhelmed and uncertain as the pandemic shifts and brings sudden change over and again, and we see the resulting health and safeguarding needs in our school age communities. Now I know I've certainly felt overwhelmed at times. What helped me? Well, without question, my colleagues, caring for and supporting one another, being kind to ourselves and to each other, reminding one another of our goals and priorities. These are the things that got us through and enabled us to refocus and look for the opportunities to provide our service in novel ways. Here in Northamptonshire, as well as our Walk and Talk initiative, which you will hear more of later, the pandemic led to the creation of our virtual wellbeing workshop programme for secondary school age young people. That was a safe, accessible format to deliver emotional health support. Feedback from the young people that participated has been really positive. Here is some of what they've told us. I feel more confident. I feel safe in the workshops. I can think more clearly. I felt I was part of something. I feel like I'm getting back to my normal. My sleep has improved. Things don't affect me so much now. I liked the fact that I didn't know anyone else in the group. I know that I'm not the only person who feels like I do. I use the breathing technique when I'm worried. Doesn't hearing all of that make it all worth it? We also produced a library of wellbeing videos in collaboration with our colleagues in CAMS and in educational psychology. You can find these on our YouTube channel. We had to step out of our comfort zone and face seeing and hearing ourselves on camera. But this is now a valuable resource that we can share with families and our school community at a time when classroom PHSE sessions are no longer possible. So you are now going to see how Newham and Northamptonshire school nurses came up with new ways of supporting families during the COVID-19 pandemic. Their case studies were chosen by the Local Government Association, and the short videos were used to promote and highlight how valuable school nursing is. You will also see the positive impact made by Derbyshire's school age immunisation team's drive-through service. and a special uplifting video from Newcastle upon Tyne school nurses. A very cheerful shout out to their children, young people and families, reminding them that they are still there for them. So thank you for listening, and I hope you feel proud and inspired to keep on doing great things, and that you also enjoy watching the videos. School nurses play a vital role in the health and well-being of children aged 5 to 19, all within a school setting, within the community and within the family. We look after their physical, emotional, mental and social well-being.
When COVID hit, we had to suddenly step away from doing our face-to-face contacts. We already had our chat health text messaging service, as well as using the phone and some video calling, but we were missing that physical connection.
If students are struggling with emotional distress and they don't get the support they need at an early time, that can often lead to more serious or worrying mental health concerns. So we needed to come up with a solution that meant we could meet with students face to face.
As a team, we were then looking at different solutions, and the suggestion was made about walk and talk and using space out in the community to actually meet with these young people that were struggling to engage in any other format.
We found local parks offered a real sense of tranquility, which really helped.
That face-to-face contact through the walk and talk meant that actually we could give a deeper assessment as to how their mood was, how they were coping physically, and address those issues in a more personal way. So a small team sat down to write a protocol that looked at keeping staff and young people safe. School nursing service is really important because it allows us to build those connections with those young people and allows them to discover strategies and build their own resilience so that they can take that forward into adulthood.
We know that healthy children will grow to be healthy adults. There was a recent report this year from the Royal College of Paediatrics and Child Health, which highlighted that actually the health of children is stalling. So if we can invest now in services like school nursing, then that will have a really positive impact for the future of the health of our nation.
Our team is made up of some specialists and public health nurses qualified in school nursing, some community nurses, nursery nurses and school nursing assistants, and we are here to support the children and the families of school-aged children here in Newham. We work with GPs, with schools themselves, with the maternity services, with obviously children's social care, and we work and support leading the Healthy Child programme, and that's looking at the emotional and physical health of children, again school-aged in the borough. Prior to lockdown, about 180 children in Newham are taken to the local hospital in every day to the A&E department, and at the very worst time, so during April, those numbers dropped right down to about 30. So we knew that the fear of catching COVID-19 and the stay-at-home messaging was preventing families from accessing emergency care, and obviously that could potentially be life-threatening. That meant, of course, that we had a responsibility as public health nurses to try and encourage families and to make sure that they knew that hospitals were open and ready to receive children in an emergency or an accident.
So we decided that the best approach to spread the message that A&E was safe to visit was to quickly produce a video with clear information that followed the NHS guidance.
Go to A&E!
So we put this video out on our council website. We shared it with our partners such as GPs and head teachers, and in June we put it on YouTube.
Go to A&E!
Currently, A&E attendance figures for children have risen from 30 to 125 a day.
It was very useful seeing the A&E video and it was good timing because my son, who's asthmatic, had to go into A&E. So it just gave us the reassurance and the confidence that we could go into A&E without no problems.
So we increased our support for schools and parents by bringing in a public health nurse, and she was providing advice and support related to COVID-19 issues. We also have a telephone response service whereby schools and parents can call in if they needed advice and support again. We were also able to assist head teachers and GPs. With head teachers, where they were being inundated with a high volume of calls, we were able to relieve that pressure off them, especially to allow them to focus more on education rather than infection control side of things when the children were returning back to school.
So we had regular touching meetings with the head teachers, and this was just to provide them with support and advice and answer any questions that they had around COVID. We was able to continue supporting their pupils that were vulnerable and had long-term conditions. We was also reviewing their care plan, so this was done virtually as well. So for asthma, where we noticed this was a high-risk area, we could review their care plan that was in school and make sure that they were safe on their return.
Let's go back to school.
We also produced a return to school video, and this was to help parents, children and young people return back to school. So where people were worried, they could see what had been implemented in school, so they felt that the school environment was safe.
I saw the video on YouTube. I showed to the kids, and the way it was made, it was fun to watch them, so it really helped.
I'm really proud of the way that our teams and our service has been able to flex and adapt the way that they work so that they can support schools, children and families in really difficult personal circumstances.
This is Hayley, who's just had her vaccine. Would you like to tell me what happened today?
Well, at first, I really made myself really anxious about it because I thought it was going to really hurt. But then, as soon as I got here, and because all of the people doing it are really nice, and it you could hardly feel it. It was just like a pinch, and just because of all of the workers that are helping you, they make you feel like you just forget about it really.
Okay, so was it really quick?
Yeah, seconds. It wasn't long.
Thank you. On a typical day, the school-aged immunisation team will administer over 200 vaccines to young people in the new innovative drive-through setting. Come rain or shine, nothing stops them delivering their service in the new normal way of working.